Let's discuss lung volumes and capacities. They're basically the volume of air present within the lungs at different phases of the respiratory cycle. Starting with the lung volumes, there are four types of lung volumes. They are the tidal volume, the inspiratory reserve volume, expiratory reserve volume, and the residual volume. Number one is tidal volume. It is the amount of air that is taken inside and outside during a normal, quiet breathing. As you see here, the graphical representation shown here is a spirogram, and you can make out where the tidal volume falls into. And how much is the normal value of tidal volume? It comes to around 500 milliliter. Now, over the tidal volume, that is apart from the normal breathing, the maximum amount of air that we can take in during a forceful inspiration or a deep inspiration, that is called as the inspiratory reserve volume. The value of the inspiratory reserve volume is 3000 milliliter. Similarly, over the tidal volume, that is apart from the normal breathing, after you do a deep inspiration, the maximum amount of air that can be forcefully expired out, that is called as the expiratory reserve volume. You can see in the spirogram, it is seen below the tidal volume, and the amount of expiratory reserve volume is 1100 milliliter. Last one is the residual volume. Even after forcefully expiring air, there is still some amount of air that remains within the lungs, and that cannot be expired out, and that is called as the residual volume. You can see in the spirogram, it takes up the bottommost portion. How much is the residual volume? It is 1200 milliliter. Now to revise, let's look at the lung volumes in the spirogram. The first one is tidal volume, the amount of air that is taken in and out during a normal respiration. Inspiratory reserve volume over the tidal volume, the amount of air that is taken in during a deep inspiration. Expiratory reserve volume is seen below the tidal volume. Apart from the tidal volume, the amount of air that is expired out after a deep inspiration, that's expiratory reserve volume. And even after expiring forcefully, there is some amount of air that remains within the lungs, and that is called as the residual volume, which is seen in the bottom of the spirogram. Now there are four types of lung capacities as well: the inspiratory capacity, functional residual capacity, vital capacity, and the total lung capacity. When we discuss lung capacities, understand that lung capacities are basically combinations of various lung volumes. The first one is inspiratory capacity. It is the total amount of air that is taken in during a deep inspiration. Now it includes the tidal volume as well. So inspiratory capacity is a combination of inspiratory reserve volume plus the tidal volume, which comes to around 3500 milliliter. Next one is the functional residual capacity. So residual means the amount of air that remains within the lungs, right? So in functional residual capacity, it basically suggests to the amount of air that remains within the lungs after a normal respiration. And it is a combination of the expiratory reserve volume and the residual volume, and the total of functional residual capacity is 2300 milliliter. Then there is vital capacity. It is the maximum amount of air that can be expired out after a deep inspiration, which includes the tidal volume as well. It is a combination of inspiratory reserve volume, expiratory reserve volume, and tidal volume, and the vital capacity of lungs comes to around 4600 milliliter. The last one is total lung capacity. It is a combination of all the four lung volumes, that is inspiratory reserve volume, expiratory reserve volume, tidal volume, and residual volume, comes to around 5800 milliliter. It is basically the total amount of air that can be filled inside the lungs. So that summarizes the lung volumes and capacities. For more such informative videos, please click the like button and also do subscribe to our YouTube channel.